So what we're going to do now is I'm going to share my screen with you. Give me a moment, please. Okay, very good. So we'll take a few minutes now, the faculty, to tell you more about our program. And after that, we'll open the floor up to questions. Okay, the Fellowship MS in Integrated Medicine and Ayurveda for doctors and advanced practice practitioners. It is really an outstanding and creative and very unique program. So, number one, our program is a recognized fellowship recognized by the American Board of Integrated Medicine, which falls under the umbrella of the American Board of Physician Specialties. MDs and DOs completing the program are eligible to sit the board certification exam offered by the American Board of Integrated Medicine. Now, in addition, and there's about 24 fellowships in the country which are recognized. Of those fellowships, there are only two, of which ours is one, which offer an MS degree. Everybody who comes through our program, when you finish after 2 years, you get an MS in Integrated Medicine and Ayurveda, which is very important. MIU is a fully accredited university, so this is a great credential to have. And another way in which our program is completely unique is that our program is the only integrative medicine fellowship that focuses on Ayurveda. So we have a collaboration at MIU with the University of Arizona Center for Integrated Medicine. The University of Arizona Center for Integrated Medicine has been around a long time. They have been a leader for decades in training physicians in integrative medicine. MIU has been around a long time, and MIU is the largest provider of Ayurvedic training and education in the West. So you're getting expert with expert to get the best training. And it is very unique. The addition of the Ayurveda is very unique, not only because Ayurveda is in itself unique, but this really provides you with, the Ayurveda will provide you with a new, actually very old, but a novel approach to assessing your patients. So in addition to doing all of the allopathic things that we all know how to do, the Ayurveda gives you another lens, another set of tools, another lens through which to evaluate the patient, and another set of tools through which to manage the patient. So it's very practical and is an outstanding complement to conventional care, and it'll be just a whole new set of tools for your practice and open new horizons for your own health and development and for that of your patients. Okay. Our curriculum is unique. It's online, part-time. You'll devote about 10 hours a week, and it's asynchronous learning. You can study on your own time, except from home, online, except every other week, there is a live webinar on Thursday night at 7 p.m. Central. And live attendance is expected. These are often case-based discussions. The faculty are there. We often bring in outside experts, dynamic and uplifting discussions. In addition, we have a residential clinical week, 1 week, each of the 2 years of the program on campus at MIU in Fairfield, Iowa. This year, the on-site clinical week will be the week of October 27th, Monday. So you arrive the 26th and depart the following Saturday. And as you're going to hear, the residential clinical weeks are truly a transformational experience and a highlight of the program. So you see here taking just a high-level look at the curriculum, that the first set of courses beginning in August and running through the spring are foundational or basic principles. an introductory course, whole systems, a mind-body course, a nutrition course, an environmental health course, a lifestyle medicine course, a five-sense therapies course, botanicals course, integrated business and legal issues. And in each course, we weave in both curriculum from the general integrative medicine curriculum provided by the University of Arizona and from the integrative Ayurvedic curriculum, which we have assembled at MIU. And then we have merged these together in a complementary and dynamic way. And then starting about 11 months from now, for those of you who will be enrolling in August, we'll switch gears and go into the organ systems, musculoskeletal system, cardiovascular and renal systems, GI, and then going into the next year, the second year, rheumatology, neurology, psychiatry, hematology, oncology, and so forth. So very thorough, very practical, and very professional. You'll find it very uplifting and informative. Now, when I talk to people about the program, as I have with many of you, not only tonight, but already I've been on Zoom or on the phone with a number of you, there are a number of things that I always emphasize. And one is that the program is intended to be practical. It is not ivory tower. This is practical, and you will be learning things that you will immediately be able to integrate into your practice, whatever the practice setting and whatever the specialty. Number two, and Dr. Leslie Elder will be telling you a little bit more about that angle in a minute. Number two, we learn a lot, we focus on pulse diagnosis. We take time and energy to teach you the Ayurvedic technique of pulse assessments, which you'll be hearing more about from Dr. Wegman in a few minutes. And then I always mention and emphasize that a major theme in our program is self-care, the evolution of the health of ourselves, of the physicians and the nurse practitioners and PAs and all of our fellows is of prime importance because it's our own evolution and our own health and transformation which provides the platform or the basis for integrating into practice. So everybody learns TM, everybody learns the yoga asana,
go into
the pranayama.
to do cross country.
Hi, please mute. Please mute the pranayama. And thank you. The experience is intended to be transformational, a journey of healing and self-transformation. We have a capstone project that you'll be able to choose for yourself. And when one of our fellows a few weeks ago gave her capstone presentation, here's a quote from her: "I'm healing by doing my assignments at school." So I couldn't put it better myself. This is the experience, is that everything we do is geared not only toward helping your patients, but helping ourselves to evolve. And with that, I will pass the baton to Dr. Leslie Elder.
Hi, everyone. I'm Dr. Leslie. So as you're starting to understand that we are all about the practical approach in this program. And we are teaching practical clinical skills that you can immediately implement in your practice. So, and I think you'll find that we as faculty, we really walk our talk. And what we want, it is our desire that you also will do the same thing. So that it's not just an intellectual kind of esoteric learning that you're doing in the fellowship, but it's actually, you're really taking this on, it becomes a part of your life. And that's the way you can teach this to your patients, this way of maintaining your health and maintaining a very healthy lifestyle and keeping yourself balanced. It's just so important. First of all, diet is extremely important in Ayurveda. And the Ayurvedic diet, as many of you might know, is the premier diet for balancing the physiology, maximizing health, and treating illness. And you will learn how to incorporate the Ayurvedic diet into your life right away, even if you have a horribly busy schedule. And this is something that I personally, it's been something I've worked on for many years of how to do this. And we will have cooking demos. We want you to get your hands dirty. This is in the clinical week where you're helping to, it's a participatory cooking demos and really learning how to cook for yourselves and how to really to know how to use diet to keep yourself in balance. Herbals, as far as herbals, we will learn about basic groups of herbs that you can recommend right away for treating common conditions you see in your practice. Mind body. As Dr. Charles said, you will all be learning TM, and TM is really a very efficient way of reaching a very deep level of consciousness. And it's a technique that's really geared towards people who are busy working people in the everyday world. It's a technique you can easily incorporate it into your daily life. That's what it's geared towards. It's not necessarily, you don't need to go off and be a monk or anything. This is something for people who are leading busy lives. Pulse diagnosis. We teach this in a very practical way so that you can just start right away just by putting your fingers on the pulse, that you can start feeling, what the balance of the doshas are and where there might be an imbalance. And that way you will know how to focus your treatment, or the daily, the changes that you want to make in yourself and in your patients. As far as exercise goes, Ayurveda is amazing as far as once you know what your body type is and what any imbalance you have, then you know what kind of exercise to recommend so that, your patients don't get drained, but instead just feel revitalized and strengthened by whatever exercise they're doing. And also you will learn about evidence-based referral guidelines as far as when to refer for acupuncture, chiropractic, and other modalities. Next slide. Here we see on the left a photo of our first cohort who came through, and they just graduated. But here they are in the clinical week. We're doing a cooking demo, and one of the fellows is participating in this. We're making up Ayurvedic remedies, and also learning how to have healthy meals and to have a good lunch and do this in a way that it's very practical for anyone to do. On the right, we see one of our expert guest faculty during the clinical week, and this is amazing that he does hooks you up to EEG, and then we look at the EEG rhythms there when you are meditating. So this is one of the fellows who's doing TM. She did TM, and you see what her EEG reading is, and then you can see when she's transcending, and we talk about different different types of meditation, and how the EEG actually is very different for different types of meditations, and they might be used in different ways. So here we have the clinical week. During the clinical week again, on the left, you see the fellows right away learning pulse diagnosis, just placing their fingers on their own pulse, feeling what their body type is, the dosha, balance of doshas, if there's any imbalances, and then they also start taking the pulses of their patients. And we have patients during the clinical training during the second year, and right away we're hoping that people will incorporate this in their lives and take the pulses of their family and their patients. And on the right, we see the fellows. There's learning how to use aromatherapy to create balance in the physiology during the clinical week. Next. And here we have, this is one of the most important things that many people, this is the reason many people love this fellowship, is because they're in a group of like-minded healers, kindred spirits, with whom they really have a lot in common. And it's great to just continue this connection, and many of them want to continue to do this even after the fellowship is over. So that's it for now, and I'm going to turn you over to Dr. Shankari Wegman.
Thank you. I just saw in the chat that there's a couple comments that are saying that you're not able to see the screen. Is that right? Can everyone see the screen? Norm,
Yes, I can. Yes.
you're able to see. Okay, 'cause there was just a comment that, maybe to share the screen. So just wanted to make sure. Okay, wonderful. You can see the screen. Okay, great.
And
Thank
Dr. Whiteman, do you have your own sharing, or shall I continue with these?
If you'd like to continue, that would be great. Dr. Charles, that would be wonderful. So wonderful. I just wanted to make sure before we continue. Thank you so much, Dr. Charles and Dr. Leslie. And as Dr. Charles and Dr. Leslie and David have pointed out, there's some unique features about our fellowship. And one of the points that I'd like to bring out a little bit more is that it's consciousness-based education. And this is a very unique aspect at Marshall International University. We really recognize that everyone has this infinite field of creativity, has this infinite field of happiness, an infinite field of intelligence within. And consciousness-based education is an educational approach that's really emphasizing the development of that inner self of consciousness alongside our traditional academia subjects. And so it's really in incorporating this value of studying consciousness that we really create education that is meaningful, and it's also holistic. In our next slide, we can see that when we talk about consciousness-based education, it's really a combination of what we're learning alongside the daily practice of transcendental meditation, or TM. There's a question about what is TM, and that's just an abbreviation for transcendental meditation. It's a technique that enables everyone to optimize their full brain functioning. It fosters intelligence, creativity, overall well-being. And it's really, the foundation on which we have that personal fulfillment as well as professional success. Everyone at our universities, students, staff, administrators, faculty, they all practice the TM technique. And there's been over 350 peer-reviewed scientific articles documenting the health benefits, including increased energy, creativity, expanded awareness, better cardiovascular health, lower cortisol levels, better sleep, better vitality. This is something, there's a quote that's also on this slide that says, if a pharmaceutical company had a pill that was capable of doing all these things, if they had all these studies showing how much help it could give, that pill would be $1 billion blockbuster. And really what this technique is that it's facilitating transcending, effortlessly opening our awareness to these deeper levels of the mind. And so learning TM, it's part of the tuition of the fellowship, and it's incorporated because really this is so helpful. In our next slide, we can see, because healthcare providers are, as you know, are exposed to so much stress and very susceptible to burnout. In fact, about 65% of US physicians, relative to other professions, have reported at least one symptom of burnout. So this one-of-a-kind training for healthcare professionals in this fellowship is engaging in an ongoing clinician-oriented self-care. So we're using evidence-based practices of mind-body medicine, really focusing on the clinician. And in our next slide, you can see this really relates to our fellowship program goals. There's 10 program goals that are here on this slide, but I'd like to focus on the first 3. So if you can press the next slide, we can see that these first 3 are looking at whole person. Oh, okay. So one person is saying they don't see the slides that I'm sharing. It could be that if you go to the top, there's 2 buttons on the left. It says meeting and Dr. Charles. If you were able to go to meeting, it's only the people there. But if you go to Dr. Charles, perhaps you can see the screen that's there. So I hope that's helpful. In this slide, you can see that what we're really focused on in our program is to facilitate whole person health for our patients. It's to practice self-care for the practitioner. And oh, wonderful, you got it, great. And then the third that I'd like to focus on is that it's demonstrating skills in relationship-centered care. So when we are talking about whole person health, which we see in integrative medicine, it's in the literature, it's in so much of the research, that's really on the basis of the practitioner themselves experiencing whole person health through their own self-care. That's why our curriculum, our assignments, all the practical clinical skills that Dr. Leslie and Dr. Charles have mentioned, all of these, we start with practicing these modalities on ourselves. That helps us to realize that third program learning objective, which is a relationship-centered care, the healing encounter, that therapeutic value that's there between doctors and patients. In our next slide, you can see that in our clinical weeks, along with all of the things that Dr. Leslie has mentioned, we practice our transcendental meditation together. We also do yoga together. So we'll go deep into, yogasanas, both in terms of what it means, like really what is yoga, as well as experiencing that with our community practice together. And you can see in this slide, some of our fellows, after practicing yoga, they're taking their pulse. So again and again, we're fostering that connection to the self, and really understanding how, like, just being self-referral, what that next step of continuing that experience of balance might be. In our next slide, we can see another technique that Dr. Leslie and Charles have mentioned is pulse diagnosis. Pulse diagnosis is known as Nadi Vigyan or Nadi Pariksha. It's a diagnostic technique that's been used for thousands of years, and it's used to assess the state of balance and imbalance by feeling the radial pulse. And this is not just about counting heartbeats, but it's really about understanding the patterns underlying the body. This is known as the doshas, something that Dr. Leslie had mentioned, Vata, Pitta, and Kapha. And it offers deep insights into a person's overall constitution, their emotional state, and also possible future health issues. So it can really help to identify the root cause of some imbalances. It can also determine the level of balance, and it's a great way to understand how to personalize recommendations of diet, lifestyle, herbs. So it really is an integral part of prevention as well as personalized medicine. And in this slide, you can see that fellows are also learning the qualities of the pulse. We do different exercises to make this abstract concept very concrete. So there's a lot of clinical skills that we practice together, both individually as well as with our patients. And our last slide is just opening this up for questions. You can see that the curriculum is both academically rich as well as experientially powerful. And it's really so that we all are enlivening this field of health for our patients as well as for ourselves. So we invite all of you to join, and we just want to open up the floor to questions that you might have.